Well, it has been a landmark week in the Thunder Bay district. For 2 days in a row, the health unit has reported 0 new COVID-19 cases. As well, the active case count has now dropped below double digits and is hovering around 9. Dr. Janet DeMille is the medical officer for the Thunder Bay District Health Unit, and she joins us for her weekly look at the COVID situation in this region. Dr. DeMille, good morning.
Good morning, Amy.
So I know you always tell me not to focus too much on those daily case counts, but 2 days in a row with 0 cases, how did that feel for you?
Really good. Really, I think, and overall, when you look at the last 7 days, and we've, the number is really low, and so our incident rate, even when we look at the weekly incident rate, is dropping with these. So it is overall very reassuring. It shows that we really do have COVID-19 under control here, and hope we can keep this up.
How likely do you think it is that we could be on track to reach 0 active cases?
Yes. Well, wouldn't that be nice? You know what? I think that there's a chance that we'll get there, maybe sometime in the next week. That's as long as nothing new kind of crops up. And of course, that's always the risk with COVID-19, is that something could be happening where we might see, a few cases and then some spread from there. And even if it remains a small number, it will obviously not help our active case number getting to 0. So, I think overall, though, this is a good situation. And even if we don't get to 0, I think we're well prepared to sort of manage any new cases that might appear and any spread and continue to contain the virus.
Mm-hmm. What do you think has made the difference in controlling the virus here? Because obviously we were in a very different situation in the winter.
Well, you know what? It is, I think, a very complicated situation. And I go back to my notes because I used to keep notes every day about the numbers. And I could see that on March 11th, we had our highest active case number, which was 470. And that was huge. So to be at 9 or to be heading towards 0 and even talking about that is a very significant different place right now. You know what? I think it's just a whole bunch of different things that really resulted in us being here. I want to just thank everybody, because we really wouldn't be achieving what we're achieving if people had been largely non-compliant with the public health measures and what all the recommendations we've had for people. And I continue to see sort of people being compliant with those measures. And I think that's really hard to do. And I appreciate it's hard to do all the time, but clearly overall our compliance as individuals and communities has been such that we were able to control COVID. And then, of course, people coming forward with immunization. I mean, we're seeing increasingly across the province and in other jurisdictions that even though people who are vaccinated can get COVID, it's fairly mild, and most of the cases and most of the hospitalizations are in individuals who haven't been vaccinated, and our numbers are likely really helping right now and preventing any ongoing spread of the virus.
Mm-hmm. I know I have seen as well in a few instances some experts from outside of the city on social media pointing to Thunder Bay, praising us for going from basically provincial hotspot to low numbers of cases. What does it mean to you to see that kind of outside recognition?
You know what? I think we deserve recognition. I think what we did here was really incredible. And it's not just, that we went from, as I said, 470 active cases at one point to 9 as right now, but it is also that we dropped so quickly, like that we got it under control really quickly, and it dropped. And I think it was a really comprehensive approach. And there are so many partners involved. I hesitate to even start naming a few who contributed, because I'll miss some. But it was a real team effort of many organizations, healthcare, social services, others who really, and the city and First Nation leadership that really kind of did their part that contributed to this.
I want to talk about the vaccine campaign now. How are things going now in terms of especially people getting their second doses, which is a real priority right now?
Yep. So we could definitely see over a little bit last week and this week that we're very much switched to second doses. So we had appointments and people were booking when the province first announced that accelerated second dose strategy. We're seeing a lot of second dose appointments, and so we see that number going up, and I think that's really good, and people are coming forward, both here in Thunder Bay and district communities, to get that vaccine, and I think our numbers are going to show that next week when we report, the number of people fully immunized, that number will go up. So we're still seeing people coming forward, getting that vaccine. I would remind people, if they haven't received their first dose, they're still very much eligible for their first dose, and I would really encourage, those people to look at what opportunities they have to get that dose, and that's really anybody 12 years of age and older. And of course, we're now seeing vaccine available in pharmacy, through primary care, through our clinic. The hospital has a clinic, and then district family health teams are really doing a lot of work around that as well.
And what we're also seeing now is the ability for people to people are calling it mixing and matching doses, so to get a different vaccine for their second dose than they did for their first one. But we've also heard about some people vaccine shopping in some jurisdictions. So wanting a specific vaccine, wanting to wait for that one, and perhaps turning down other appointments. Is that something you're seeing here?
So we haven't, we started sort of, and I realized that there was sort of some last minute changes because of supply delivery, issues this week that, so we had to sort of quickly switch some of the clinics that were available. And, there were some people who had a preference as to which vaccine they got, but I think a large majority of people really were accepting. I mean, these are very similar. They're almost the same vaccine. They just have different names and different companies producing them. And the idea of sort of mixing or vaccine products is not uncommon with our regular vaccine products that we get, because they're made by different companies, but they're essentially the same vaccine. And I figured at some point we would get to that where there would be that sort of more interchangeability. We really hadn't had to do it up to now, because it did seem like, we either had a lot of Pfizer around or a lot of Moderna around, and there didn't really be the need to do that. But certainly with the second doses increasing, I would encourage people to get, the vaccine that's available to them as soon as possible, so that they get fully immunized. And it's very safe and effective to do that. I'm sort of waiting for my second dose. I'm imagining I'm going to be doing that mix myself. So I certainly, really encourage people to just access, take the vaccine that's available. And those people who maybe don't want that, that's up to them, and they can, seek a pharmacy, for example, that has a particular type.
I also saw that the health unit was setting up kind of a backup, a waiting list if people wanted to sign up to kind of be on standby in case there are extra vaccines available on a certain day. Can you tell me about that, why that's something you wanted to do?
So we got a lot of supply, and can see a lot of people through our clinic, and we're also we thought if people are not showing up for their appointments, there's always that issue that somebody has taken an earlier appointment somewhere else and perhaps not canceled their appointment that we have in the clinic. So we really want to make sure we're getting through vaccine. Because of the expanded sort of eligibility, there's a lot of people that can come forward, and we were seeing that people were very willing to do that, to kind of sign up in the morning and be available that day if they can get to our clinic within sort of half an hour time frame, that we would be able to vaccinate them. So it's really making sure that we're delivering every single vaccine dose that we have on hand for that day, and inviting. And so if they're filling up any missed appointment, people who don't maybe not show up or who didn't cancel, and just being really available. And I do anticipate, actually, as we go forward, there'll be more, we'll move towards that more, actually, in sort of a walk-in approaches, and getting people on the same day.
In terms of people missing their appointments or maybe getting one somewhere else and not canceling them, how often is that happening?
So I think with the provincial booking system, and a lot of our clinics are booked through the provincial booking system. They actually, it's automatically canceled somebody's second dose appointment, and really they did some cleanup. The province did some cleanup in that database, that scheduling system, even in the last week to ensure that everybody, it's canceled. I think one of the challenges is if we have an appointment canceled in the clinic, sometimes there's not the opportunity to rebook somebody in that appointment. So even though we know something is canceled, it doesn't get filled by someone else. So that's another issue that we have. We also have our own scheduling system, which is a little bit easier to stand up a clinic, and we use it. We've used it sometimes, and we don't have actually that ability to really cancel second dose appointments. So we're not. There's a number of things that sort of influence people. The number that we're expecting at the clinic and the number of actually show up. But I think it's actually been working really well in terms of our our backup list, which has been in place.
Because obviously you don't want to be left with extra doses and end up wasting doses at the end of the day.
Yeah, I mean, they're not necessarily wasted because we can use them the next day if it's an unopened bottle. But we've been very good actually at managing that. But we also want to get our supply out. We are getting supply. We're getting more supply, and we're doing 1,000 or more doses at our mass immunization clinic, and we want to make sure we achieve that. We know that there's a lot of people who are eager to get their vaccine, and we're very pleased to be out there and giving them their vaccines.
Of course, things are starting to reopen now, and as that happens, we're hearing a lot of talk about questions about when the border should open. Pressure certainly mounting in some cases for the government to open the U.S. border. What are your thoughts on that? Are we anywhere near ready?
You know what? I think we're very much going in the right direction to be ready. I think there's very much an uncertainty around the Delta variant right now, and I think we're learning more and more about that and how the vaccine really helps prevent the spread of the variant. But it still feels like one of those areas where we're still, kind of looking at and waiting for those answers and more clarity about the implications. The United States overall has a lower vaccination rate than we do, even though that their second dose vaccination rate is higher. And I think, it's important to look at, we have to protect our communities from, cases coming into our area, especially if they're Delta variant. And we might see, and what we've seen in England and the UK overall, is an increase in number of cases due to the Delta variant. I think there's a concern that might happen in some areas of the United States based on that. And so that does put us at risk. At the same time, as we get increasingly vaccinated here, especially with those 2 doses, I think that it becomes more, we're protected even if there is introductions of the vaccine, the Delta variant in our area. And I think it's really trying to find the right balance of that.
Well, Dr. DeMille, we'll have to leave it there for this week. But as always, I appreciate your time. Thank you.
Thank you very much, Amy.
Dr. Janet DeMille is the medical officer for the Thunder Bay District Health Unit.